Okay, awesome. All right, so we're going to do chapter 38, and that's the foundations of radiography, radiographic equipment, and radiation safety. Your learning objectives is to pronounce, define, and spell the key terms. We're going to describe the uses of dental imaging, who discovered X-rays. We're going to discuss a little bit about physics. We're definitely going to identify the parts of the dental X-ray machine and X-ray tube, which is something that I already showed you guys yesterday. So a lot of this is going to sound very familiar to you guys. So the dental assistant, they must have a thorough knowledge and understanding of the importance and uses of dental imaging. Dental imaging enables the dentist to see conditions that are not visible in the oral cavity. And the dental assistant must understand the fundamental concepts of atomic and molecular structure and have a working knowledge of ionization, radiation, and the properties of X-rays. Now, radiation is used to produce dental radiographs, and it has the capacity to cause damage to all types of living tissues. Any exposure to radiation, no matter how small, has the potential to cause biologic changes to the operator and the patient. The dental assistant must have a thorough understanding of the characteristics of radiation to minimize radiation exposure to both the dental patient and the operator. And I told you yesterday, we use the X-ray shield barrier, we use the lead apron with the thyroid collar, and we're going to discuss some other things too. Now, moving on to discovery of X-rays. So Wilhelm Conrad Röntgen was a Bavarian physicist, discovered the X-ray on November 8, 1895. For many years, X-rays were referred to as Röntgen rays. Radiology was referred to as Röntgenology, and radiographs were known as Röntgengraphs. During his lifetime, Röntgen was awarded many honors and distinctions, including the first Nobel Prize ever awarded in physics in 1901. Yeah, and here is Mr. Röntgen, okay? Now, Mr. Röntgen, if you look in your Kindle, okay, there is a picture of Röntgen's wife's hand, who he used to use to basically take x-rays on her hands, and it shows that he exposed her to the rays for 15 minutes and to capture the image. So there in your Kindle, there's a really good picture of her hand, okay? And this event was also recorded as the first radiograph of the human body. So again, look in your Kindle because there's a great picture of her hand in there. This is the Crookes tube, okay? We're going to talk a little bit about this. This is what's in that X-ray tube head. Of course, it has been modernized, so it's way different than this. Now, we have other pioneers in dental radiography. We have Dr. Otto Wolkoff. He made the first dental radiograph. Dr. Kells, a New Orleans dentist. He's basically credited with the first practical use of radiographs. So in his office, he was the first one to use it in 1896. Now, X-rays have progressed from these early discoveries to the science of it is today. And, that's where digital is something new. And we're going to talk about something else that has changed in dentistry. And then new technology continues to improve our diagnostic abilities. Now, all things in this world are composed of energy and matter, and this is where we talk about radiation physics. Atoms are the basic form of matter, and they contain energy. Energy is defined as the capacity to do work. Matter is anything that occupies space and has form or shape. Matter is made up of specific arrangements of atoms called molecules. Now, an atom has two parts, central nucleus and orbiting electrons. You guys might have remembered this when you were back in high school, some of you not too long ago. It's identified by composition of nucleus and arrangement of orbiting electrons, and electrons remain stable in their orbit unless disturbed or moved. X-rays can disturb orbiting electrons, and here's a picture of it. Again, you want to look closely into it. Look in your Kindle, okay? Now let's talk a little bit about nucleus or dense core of the atom is composed of particles known as protons and neutrons. Protons carry positive electrical charges. Neutrons carry no electrical charge. Dental X-rays do not affect the tightly bound nucleus of the atom and are only changed in direction or scattered. Dental X-rays cannot make atoms radioactive. Therefore, patients do not give off X-rays after the X-ray machine stops producing X-rays. Every atom has a nucleus. So electrons are also tiny negatively charged particles with very little mass. Electrons orbit around the nucleus of an atom. The orbit path of an electron is called an electron shell, and each shell can contain only a specific number of electrons. The electrons are maintained in orbit by electron binding energy, a force similar to the force of gravity on Earth. And here's another picture. Again, you will find this in your Kindle. Let's talk a little bit about ionization. Electrons remain stable in their orbits around the nucleus until X-ray photons collide with them. A photon is a minute bundle of pure energy that has no weight or mass. Ions are atoms that gain or lose an electron and become electrically unbalanced. X-rays have enough energy to push an electron out of its orbit, producing an ion, an atom that gains or loses an electron and becomes electrically unbalanced in a process called ionization. I know those are one of your key terms, so there is the definition. Again, you can find the definitions in your Kindle. The properties of X-rays. X-rays are a form of energy that can penetrate matter, like visible light, radar, radio, television waves. They belong to a group called electromagnetic radiation. And electromagnetic radiation is made up of photons that travel through space at the speed of light in a straight line with a wave-like motion. The shorter the wavelength of the X-ray, the greater is its energy. I want you guys to definitely take a look at this picture in your Kindle and notice the wavelengths here, okay? You have, starting on the top, you have radiotherapy, then X-rays, then sun, photography, microwave, radar, television, and radio. And it shows you in wavelengths, okay, the different measurements, the unit of measures of it. If you notice, microwaves, and of course, you know, when they made this, cell phones were not on this list, but cell phones are pretty high up there, just like your microwaves, okay? So please take a look at that and your Kindle. Now, let's talk a little bit about characteristic of X-rays. They're invisible and undetectable by the senses. There's no mass or weight. There's no charge. They travel at a speed of light. They travel in short wavelength, high frequency waves. They travel in a straight line and can be deflected or scattered. They are absorbed by matter. And in our case, matter is the cheek. It can cause ionization. It can cause certain substances to fluorescence. It can produce image on photographic film, and it can cause changes in living cells. Here's how wavelengths look. This is the shorter wavelength on the top over here, and this one is the longer wavelength, okay? And the wavelength is the distance between the crest. Crest is also known as a peak of one wave and the crest of the next wave. And the frequency is the number of wavelengths that pass a given point in a certain amount of time. The shorter the wavelength, as I mentioned before, the higher the frequency will be, and vice versa. Now, the components of the dental X-ray machine. This is what you guys really need to know, okay? So there are three primary components, and all X-ray machines are a little bit different, but they have these three: the tube head, an extension arm, and the control panel. So yesterday I showed you that on the tube head, we have what's called the position indicator device, or for short, PID. And this is where you put the position indicator device in the ring. You basically want to target that, okay? The extension arm, I showed you that if it's not properly extended, your tube head is going to float. So So you want to make sure that you open up that extension arm and make sure that your x-ray tube head is not floating, because if it is, you will not get a good x-ray, and we'll talk about that, I believe in chapter 39 or 40, one of those chapters. All right. Your tube head, the x-ray tube head is tightly sealed. Heavy metal housing contains the x-ray tube that produces dental x-rays, okay? And inside your tube head, this is all the things that are inside your tube head, okay? We have a filament, an electron cloud, focal spot on the tungsten target, a glass envelope, vacuum, a copper stem, an anode side like a battery, a positive, and we have a cathode side, which is the negative. We have an electronic focusing cup and the tube window. And out of that tube window, we have the position indicator device where we'll get the useful x-ray beam from. So inside that tube head, this is what it looks like. Again, every tube head is a little bit different, but they all have those pretty much those same parts inside of it. Now the components of the tube head, the metal body of the tube head that houses the x-ray tube is called the metal housing. It's filled with insulating oil. I will tell you this, that if you are taking an x-ray and you're holding the tube head and oil is leaking out of the tube head, you must let someone know, okay? In the school situation, it would be your instructor. In the office, it would be the doctor, okay? The tube head seal is made of leaded glass or aluminum and keeps the oil in the tube head and acts as a filter for the x-ray beam. The x-ray tube is where x-rays are produced, and the transformer alters the voltage of incoming electrical current. The aluminum filter is an aluminum sheet 0.5 millimeters thick. The lead collimator is a metal disc with a small opening in the center to control the size and shape of the x-ray beam as it leaves the tube head. Tomorrow, when you come back into lab, I want you to look inside the PID, position indicator device, and you're going to see the lead collimator in there. And the PID is the open-ended lead-lined cylinder that extends from the opening of the metal housing of the tube head, and is used to aim the x-ray beam. So again, you used the tube head yesterday, but now I want you to know a little bit about it. The vacuum environment allows the electrons to flow with minimum resistance between the electrodes, and I mentioned to you the cathode and the anode. The cathode consists of a tungsten filament in a focusing cup made of molybdenum, and the purpose of the cathode is to supply the electrons necessary to generate x-rays. Electrons are generated in the x-ray tube at the cathode. The hotter the filament becomes, the more electrons are produced. And the anode is the target for the electrons. It's composed of a tungsten target, a small block of tungsten embedded in the larger copper stem. The copper around the target conducts heat away from the target, reducing wear and tear on the target. And the purpose of the tungsten target is to serve as a focal spot and convert the bombarding electrons into X-ray photons. The X-rays at the center of this beam are known as the central ray. Now, you might say to yourself, Ms. Perez, why are you telling me all this? Again, everything that's inside that X-ray tube head is working. We don't see those components of how an X-ray beam is coming out. So a little bit of knowledge is powerful, okay? Position indicator device, PID, okay, is lead lime, is used to aim the X-ray beam at the filter in the patient's mouth. The open end of the PID is placed against the patient's face during film exposure, and it could be cylindrical or rectangular. If you guys remember, we have the cylindrical, okay? Extension arm encloses the wire between the tube head and the control panel, and it has an important function in positioning the tube head. The extension arm folds up and can be swiveled from side to side. The dental assistant or the patient must never hold the tube head to keep it in place during exposure. Yeah, you should never. Will it happen? Sometimes, but you should never, okay? Control panel of an X-ray unit contains a master switch. So that's where we turn it on and off. The indicator light. The selector buttons. So yesterday I showed you selector buttons, and yesterday we had it on bite wing. I also showed you how to expose an adult or a child, and our Dexter head would be an adult. We have our exposure buttons, the control devices, the time, the milliamperage, which is your MA selector, and your kilovoltage, which is your KVP selector. Again, yesterday I pressed the button so I can show you the MAs, the KVPs. Different X-rays have different MAs. Now, a single centrally located control panel may be used to operate several tube heads located in separate treatment rooms. In our case, each tube head has their own control panel. Now, the master switch, as I mentioned, is on and off. An orange indicator light shows when the master switch is on. Ours is green. Okay, so they can come in different colors. I've seen them in red. Red emission indicator light comes on when the exposure button is being pushed and X-rays are being emitted. An exposure button and selector buttons, they control the flow of electricity to generate the X-rays. Exposure time is measured in fractions of a second called impulses. 60 impulses equal 1 second, 30 impulses equals 0.5 seconds. So this is where you guys press that button. And like I told you guys yesterday, some of you were going crazy on the button, just pressing it like crazy, you know, a couple of times. You want to press the button, wait until you hear the beep, and then let go of the button. If you, once the beep goes, if you keep your finger on the button, then it will cause an error, and that's where you hear the several beeps. So again, just make sure you press the button, let it go as soon as you hear the beep. Now, the milliamperage, the MA, is a measure of electrical current passing through the tungsten filament, and the kilovoltage peak, KVP selector, is used to control the penetrating power of the X-ray beam. These two words are also part of your terminology, so there is the definition for them. Now, I am going to check to see if you guys have any questions on the chat. Any questions?
No.
Okay, we are going to continue. So we're going to learn a little bit more of how X-rays are produced and the types of radiation. We're going to describe the three characteristics of the X-ray beam, the quality of X-rays, again, the milliamperage, what it affects, how it affects the quality of the X-ray beam, and the differences between contrast and density. We're also going to discuss the effects of radiation, including the following: the biological effects of radiation exposures on the human body, and we're going to identify the critical organs that are sensitive to radiation. Yes, but not in this lecture. X-ray production. The X-ray machine is plugged into the wall outlet, as you all, if you didn't notice. And when the machine is turned on, the electrical current enters the control panel. Current travels from the control panel to the tube head through electrical wires in the extension arm. Current travels through the step-down transformer to the filament of the cathode. The filament circuit uses 3 to 5 volts to heat the tungsten filament in the cathode portion of the X-ray tube, and the heating of the filament results in a thermonic emission. All of this takes place as soon as you guys press that exposure button. Okay, so when you're about to take the X-ray, everything I said happens. So when the exposure button is pushed, the high voltage circuit is activated. The electrons in the cloud are accelerated across the X-ray tube to the anode. The molybdenum cup in the cathode directs the electrons to the tungsten target in the anode, and the electrons travel from the cathode to the anode. When the electrons strike the tungsten target, their energy of motion, which is called kinetic energy, is converted to X-ray energy and heat. And this is what's going on, okay? So again, believe it or not, a lot of stuff is going on when you press that button, okay? But you don't know it because you can't see it. I wish the X-ray tube head was clear so you can see it, but the reason why we have that plastic shell covering is, number one, we don't get burned because there's a lot of heat going on. And we'll talk about that too, and all the different types of radiations. X-ray production, there's less than 1% of the energy is converted to X-ray. The remaining 99% is lost as heat. So again, I'm going to repeat this. Less than 1% of the energy is converted to X-rays, and the remaining 99% is lost as heat. So again, a lot of patients, and going back to that electromagnetic radiation chart, I really want you to look at that chart and see how long X-ray radiation is versus the sun, the microwave, your cell phone. Google the cell phone and see how much radiation comes out of your cell phone, okay? Exactly. Outside, okay? Background. I mean, there's so much radiation everywhere else. And so when patients, you know, and the reason why we tell you this, because you're going to hear it every single day. Patients will complain about the radiation that they're being exposed of. And you need to have good answers, you know, and that's why we go over this. Continuing on, heat is carried away from the copper stem and absorbed by the insulating oil in the tube head. The X-rays travel through the unleaded glass, window, tube head seal, and aluminum filter. The aluminum filter removes the longer wavelength X-rays. The X-ray beam travels through the collimator. And remember, I told you I want you to look through the PID so you can see it. X-ray beams then travels down the lead line and PID and exits at the end of the PID. Now, here's the types of radiation. Again, these are some of your terminology words. So your primary radiation is made up of X-rays that come from the target of the X-ray tube, useful beam or primary beam. You have the secondary radiation that is created when the primary beam interacts with matter. Your scatter radiation is a form of secondary radiation that occurs when an X-ray beam has been deflected from its path by interaction with matter. Now, the scatter portion of secondary radiation is dangerous and may expose any of the patient tissues that are not protected by the lead apron. And if you guys look in your Kindle, you can see this picture here, and it's showing you the different types of radiation. The primary beam that I just mentioned, secondary, and scatter. So please remember that. That is part of your terminology. It's also going to be on your test. Most of your terminology words are going to be on your exam. Your radiolucent and radiopaque characteristics. Now, this is important for you guys to know when you're taking x-rays. I know right now when you're taking x-rays, because right now we're just taking x-rays just so you guys can get used to it, but you don't really know what you're looking at yet. You probably only see black and white. So this is where we're going to go a little bit into what you're seeing on an x-ray. Radiolucent structures allow x-rays to pass through them. So they appear dark or black on the radiograph. Air spaces, soft tissues on the body, and dental pulp appear as radiolucent images. Your radiopaque structures do not allow x-rays to pass through them, and they appear white or light gray on the radiograph, such as your metal, enamel, and dense areas of bone appear as radiopaque images. Yep. So here is a bite wing x-ray, okay? And I really want you to look over here and look in your Kindle, okay, on your pictures, so you can see what you're looking at, because when you mount x-rays, you need to identify a couple of things. So here we have a bite wing radiograph. It's showing radiopaque. Remember, radiopaque is the white areas of amalgam restorations, and radiolucent, which is your black areas of air and cheek matter. So if you look at my arrow here, here is your amalgam restorations. Okay, you guys see that? Those are your amalgam restorations. And then Your black areas, okay, are your ear and cheek. So black over here, in here, and in here. Now, we are going to discuss a little bit later on more the different parts of these, what you can see on the teeth. But real quick, because this is a really good x-ray for me to show you a couple of things. Here are the nerves, okay, in your premolars, and then back here is your molars. You guys can tell the difference between your molars, okay? So now you can see these are the molars, and these are the premolars. Okay, and then down on the bottom, here's a premolar, and guess what is missing here? The first molar, okay, and here's the second molar. All right, so in this x-ray, we have two premolars and two molars on the top, two premolars. We have one molar because the other one is missing. All right, so again, we will be going a little bit more into this as we take more x-rays and as you're mounting, because you need to identify what you're mounting, number one. And also, we will be charting from x-rays. So what I'm pointing out to you, you would need to know, because we're going to transcribe the x-rays and put them on charts. So characteristics of the x-ray beam, there are three, okay? Characteristics that are necessary for a good radiograph. Quality is one of them. This is another one of your terminology words. It's used to describe the energy or penetrating ability of the x-ray beam. Quantity, it refers to the number of x-rays produced in the dental x-ray unit. And intensity is a combination of the number of x-ray photons, which is your quantity, and energy of each photon, which is your quality. Now, the dental assistant must understand how variations in the character of the x-ray beam influence the quality of the resulting radiographs. I'm just checking to see if anybody's chatting, to see if anybody has any questions. Okay, I am back. Remember, you can ask any questions on the chat since I can't hear you, and then I'll come back and answer all those questions. Yes. By the way, I do have a guest with me. Okay, so you might hear me answering the guest, but yeah, I can see. All right, let's go back over here. So let's talk about contrast. An ideal contrast of an image clearly shows radiopaque white of a metal restoration, radiolucent black of air, and many shades of gray between. The higher kilovoltage produces more penetrating x-rays and lower radiographic contrast. A 90 kVp setting requires less exposure time and produces a radiograph that has low contrast, more shades of gray. A 70 kVp setting requires a slightly longer exposure time and produces a radiograph with high contrast, which is fewer shades of gray. So a standard preset setting is about 70 kVp with 8 MAs, okay? So when X-ray machines has these set readings, only exposure time may be altered, okay? And we can alter it. And I want you to play with the buttons. Of course, I don't want you to hit the exposure button, but I want you to play with the buttons on the control panel so you know exactly what we're talking about when you come into lab, okay? Now, the amount of contrast in a film often reflects the dentist's preference. Some dentists prefer image with more contrast, whereas others prefer lower contrast. And here is an x-ray, okay? So A is a diagnostic radiograph. Remember we talked about yesterday in the very beginning, why do we even take x-rays? Because we need diagnostic x-rays so the doctor can make a treatment plan, so he can see what's going on. So in letter A, this is a really good x-ray as far as the increase. Yep. And also in this here in B, they increase in kilovoltage, so it results in an image that exhibits increased density. What does that mean? That it's very dark, as you can see the difference here. Yeah. So if you guys look I want to go back to A because B is dark. So I don't know if your doctor is going to like that x-ray. Again, every doctor prefers, their own contrast. But really, you want to be able to see x-rays like this because we need to see interproximally, okay, the mesial and the distal. We're looking for cavities. The doctor is looking for plaque. The hygienist also, okay. We're looking to see bone loss, okay. Yeah, there's a lot of things going on. So if you take an x-ray like letter B and the doctor did not ask you to take an x-ray like that, it's, as you can see, it's very hard to see those premolars, interproximals, the mesial and distal. Okay, it's really hard. Now here's a decrease in kilovoltage. So again, A could be a diagnostic x-ray because we still can see, okay, interproximals, all right. And again, here's the premolars, here's the molars. But look at B, all right. The image is so light that the doctor probably cannot see what he needs to see. All right. So that's a decrease in kilovoltage. I'm sorry. Yeah. We are going to be talking about something called overlapping, which we see a little bit of that once we get to it. And density. So I mentioned this already. It's the overall blackness or darkness of an image. A radiograph with the correct density enables the dentist to view those black areas that I pointed out to you, which was the air spaces. The white areas are your enamel, the dentin, the bone, and the gray areas are your soft tissue. Let's come back to one of these here. So here's your soft tissue down here. Up here is your enamel. Here's your nerve. I like this because you could really see the molar nerve here, okay? The pulporins, the chamber. Here's on the premolars, okay? But if I wanted to show you on the B, I couldn't show it to you because, it's too light. So see what difference it makes, all right? Also, the degree of density is determined by the milliampere seconds, which are your MAs. Now, there are normal differences in bone densities. They're obvious between the maxilla, which is the upper, and the mandible, which is the lower. All right, moving on here. So you will find this in table 38.2 in your Kindle, okay? Just kind of take a look at it for milliamperage and kilovoltage. This is the influence of X-ray beam factors on density and contrast of images. So again, your density is the overall darkness or blackness. If you change the KVP, which again is the kilovoltage peak, it results in a change in the density in an X-ray. Now, what's the other factors? So this is important for you guys to remember too, because I saw some of you guys do this yesterday. The distance from the X-ray tube to the patient. So say you have the tube head a good few feet away from the patient's cheek. Will you get a good diagnostic x-ray? Probably not, okay? So the distance from the x-ray tube to the patient, if the operator lengthens the source image distance without changing the exposure settings, the resulting radiographs will be light or less dense. So if you're way far away from the face, you're not going to get a good x-ray, okay? Developing time and temperature can affect the overall density. If the processing time is too long, the radiograph will appear dark. Well, good news. You have an automatic processor that does that all for you. Back in my days, we had to dip the x-rays in a dip tank. And if you didn't do it right, then your x-rays were a hot mess, okay? And we will be talking about that too, because there is a part in your lecture that talks about that. Now, another thing that might affect your x-rays is the body size of the patient. A patient who's very small or thin requires less radiation than does a husky, heavy bone person, okay? So again, if the PID is changed on a tube head, it is important to adjust the exposure time accordingly, okay? Yes, that's right. My guess is telling me that ethnicity is a factor also, and that is true. All right, geometric characteristics. Let me just see if anybody's chatting. No, we're okay. 3 geometric characteristics affect the quality of the radiograph. Sharpness. You want detail, resolution, or definition. Distortion. Disproportionate change in size of images caused by excessive or insufficient vertical angulation. And magnification. Proportionate enlargement of a dental image. Now, we're going to get more into that, but yesterday I started you guys with bite wings just for you to get a feel of it. I wanted you to get a feel. We are going to be talking about, how you hold the PID a little bit better and making sure that you have these 3 geometric characteristics. Okay, so we'll be going into this a little bit more when you come into lab. Now, sharpness refers to how well the radiograph reproduces the fine details or distinct outlines of an object. It's sometimes referred to as detail, resolution, or definition. And it's influenced by 3 things: the focal spot size, which is a small focal spot produces a sharper image than does a machine with a larger focal spot size. Film composition. Fast film speeds result in less sharp detail. So I'm going to show you the different boxes of film. Movement. Any movement of the patient or image receptor will degrade image sharpness. So you can have movement of the patient or movement of the tube head. Okay.
You walk away, their mouths move.
Exactly. Once you walk away, you don't know what patients are doing, okay, behind your back. So you have to let them know once they bite down, please don't move.
And be quick.
Yeah, and that's why I was rushing you guys, because some of you guys were walking like turtles. Your patients, if you walk to the button like a turtle, your patient will definitely move your x-ray. Now, radiation effects. All ionization radiation is harmful and produces biologic changes in living tissues. The amount of X radiation used in dental radiography is small, but biologic changes do occur. The dental system must understand how the harmful effects of radiation occur and how to discuss the risks of radiation with patients. Entire X-ray area is considered a radiation hazard area. So exercising safety precautions will minimize radiation exposure to patients and operators alike. One of your first protocols that I told you was to stand behind the X-ray shield barrier. Okay, we're learning. So we don't want to expose ourselves. We want to stand behind it, okay? And we're going to get more into that and how to protect not only us, but the patient. Now, tissue damage, ionization. Ionization is the harmful effect of X-rays in human beings that can result in a disruption of cellular metabolism and cause permanent damage to living cells and tissues. Ionization is the process by which electrons are removed from electrically stable atoms through collisions with X-ray photons. The atoms that lose electrons become positive ions. As such, they are unstable and capable of interacting with and damaging other atoms, tissues, or chemicals. So we mentioned this earlier today, that we are exposed to background radiation every day, just from walking outside to your car. Okay, my guest mentioned that before. We are exposed to radon from the soil of the earth as well. So, again, you have to have a good comeback when the patients are complaining about 18 x-rays, because you're going to hear it. Another x-ray, if you guys don't have the answers, they're going to eat you up alive.
Best comeback. You get more radiation walking to your car.
Exactly.
From the sun.
Exactly. Or standing in front of the microwave. Okay. That's why it has a timer. Walk away. All right. Let's move on to biologic effects of radiation. So exposure to radiation can bring about changes in body chemicals, cells, tissues, and organs. The effects of radiation may not become evident for many years after the x-rays were absorbed. This time lag is called the latent period. This is another one of your terminologies, okay? And again, if you remember, going back to who discovered x-rays, and also who is the dentist who exposed his hands to x-rays every day for years, and in whom cancer eventually developed as a consequence. There was 2. One was Kells and the other one was Rankin. Oops.
20 minutes on his hand.
Yeah, 20 minutes, 15 to 20 minutes.
Fell apart.
Yeah, cumulative effects. So, exposure to radiation has a cumulative effect over a lifetime. What does that mean? Over time, okay? Over and over again. So when tissues are exposed to X-rays, some damage occurs. Tissues have the capacity to repair some of the damage. However, they do not return to their original state. The cumulative effect of radiation exposure can be compared with the cumulative effect from repeated exposure over the years to X-rays of the sun. So think about your surfers. Think about the people that are constantly exposed to the sun over
Skin
time.
cancer.
Right, exactly. They can develop skin cancer. A lot of times their skin looks weathered, rough, leathery, wrinkled, okay? And that's what happens over the time, okay?
We're not exposing 20 minutes of it.
Exactly.
Half of a millisecond.
If you guys remembered, I mentioned to you that an FMX, you should be able, once we are finished, now, right now, just 4 bite wings is taking you like 10 to 15 minutes. An FMX, right, an FMX should be taking you less than that, okay? And we'll get better with the time, okay? We are learning, so by the time we're doing an FMX, you know, you will be timed, okay? Now, disorders of critical organs. I want you to look at table 38.3, and it'll tell you the critical organs and the disorders. For instance, lens of the eyes, cataracts, bone marrows, leukemia, salivary, thyroid, skin, cancer, and your gonads is genetic abnormalities. So this again shows disorders of critical organs resulting from a cumulative of radiation exposure. Now you have 2 types of radiation exposure, acute and chronic. Acute radiation exposure occurs when a large dose of radiation is absorbed in a short period, such as in a nuclear accident. Chronic radiation exposure occurs when small amounts of radiation are absorbed repeatedly over a long period. It may be years after the original exposure before the effects of chronic radiation exposure are observed. If anybody, science, social studies, Hiroshima, okay, they had a little bit of both. Automatically, they had acute nuclear accident. Then over time, they had chronic. They saw what the long-term effects were, okay? There was another one not too long ago. I can't remember. Which one?
Russia.
Russia, yes. Yes, the one in Russia, okay. Um, I'm gonna check.
Long-term,
Yeah.
it's been 30 years now.
Exactly. And talking about Russia, that there is still active radiation over there. I'm gonna try to post a video on that, and so you guys can see a little clip about it, okay?
There's a movie on Netflix.
Yeah, exactly. There was a movie on it in Netflix. And actually, it's a very good movie, so I'm going to look for it. Genetic and somatic effects. X-rays affect both genetic and somatic cells. Genetic cells are the reproductive cells, sperm and ova. Now, the damage to genetic cells is passed on to succeeding generation, and all other cells in the body belong to the classification of somatic tissue. X-rays can damage somatic tissue, but the damage is not passed on to future generations. So they have here a comparison of somatic and genetic effects of radiation. So please look on your Kindle. Critical organs, we mentioned these already, okay, on that little diagram, your skin, thyroid gland, lens of the eye, bone marrow.
Most patients are worried about thyroid.
Yeah, that is true. Most patients are worried about thyroid, and I mentioned that to you yesterday, that some offices have the lead apron with the thyroid collar. Some offices just have the thyroid collar. It all depends on which office you go to, okay? Again, I'm asking now if anybody has any questions, hit it on the chat if you do, and I'll take a look at it. If not, I am going to continue on. Please hang in there. We are almost done, okay? So now we're going to discuss how radiation is measured. Radiation safety, we're going to discuss about, as I mentioned to you, not only protecting the patient, but protecting the operator. Please know that the operator is you. And we're going to also talk about the ALARA concept. Now, radiation measurement can be measured in a manner similar to that used to measure time, distance, and weight. There's two sets of systems that are used to define the way in which radiation is measured. The older system is referred to as the traditional or standard system, and then you have the newest system is the metric equivalent known as the SI, the Sistema Internazionale. Now, the traditional units of radiation measurement is your Rankine, which is your R, your radiation absorbed dose, RAD, and your Rankine equivalent man, REMs. And then your SI units, okay, you see them here. You have your C or your kg, the coulombs per kilogram, your grade, GY, and your Servet, which is your SV.
Most offices provide badges too.
Yes, yes, and we'll get into that. Maximum permissible dose, your MPDs of whole body radiation for those occupationally exposed to radiation is 5,000 MREMs. That's your 5.0 REMs. I am going to tell you this right now. Remember 5.0 REMs for your exam. It is going to come up of what is the maximum permissible dose. This amount of radiation to the whole body carries very little chance of injury. For non-occupational exposed persons, the current PID is 500 MREMs, which again is the 5 MSV per year. Again, just remember 5.0 REMs. Dental personnel should strive for an occupational dose of 0 by adhering to strict radiation protection practices. So if you guys are doing everything that we're going to discuss, you will be at 0, okay? Radiation safety. Background radiation comes from natural sources such as radioactive materials in the ground and cosmic radiation from space. Exposure from medical or dental sources is an additional radiation risk. And when dental radiographs are prescribed and exposed, the benefit of disease detection far outweighs the risk of biologic damage from receiving small doses of radiation. I want to say, please remember that the only one that prescribes x-rays is the dentist. What do I mean by that? What I mean is if when you go into a practice and the dentist tells you that for every new patient, he wants an FMX, he is telling you that he is prescribing for every new patient, you are to take an FMX. If he says that for every checkup x-ray, checkup patient, he wants 4 bite wings, he is prescribing 4 bite wings. If he tells you that for every emergency that comes in, he wants a PA x-ray, then that is what he's prescribing. Don't take whatever you think you want to take. You take what the dentist prescribed.
You're under supervised revision.
Exactly.
And you'll figure it out when you're with the dentist.
Exactly. Now, the responsibilities of the dentist, again, he prescribes radiographs only for diagnostic purposes. To ensure that all radiographic equipment is properly installed and maintained in a safe working condition. To provide appropriate shielding to protect staff and patients from the effects of radiation. To require that anyone exposing radiographs be properly trained and appropriately supervised while exposing them. To obey all state radiographic licensing requirements, rules, and regulations, and to participate in obtaining informed consent. So when the patient fills out their medical history, there's usually areas in there with the paperwork that allows us to take x-rays, okay? So it is important to stay current with the latest recommendations regarding radiation exposure in the dental workplace, protective methods, and new equipment developed to decrease exposure.
And when they say no, there's new forms.
Right, exactly. And if a patient says no, there are forms for the patient to fill out. Because, you know, when they do say no, if there's something going on in their mouth and they don't allow us to take x-rays, we don't want them to come back and say, you know, they had cancer and we never diagnosed them, things like that, you know, whatever the case may be, an abscess that blew up, you know, so we have to make sure we protect ourselves. Now, protective devices. The dental tube head must be equipped with certain appropriate components, aluminum filters, lead collimators, and PIDs, which ours are. Equipment should be checked on a regular basis by state or federal regulating agency. Faulty or malfunctioning equipment should be repaired immediately. So what did I tell you was one of the things that you guys should let us know? Any oil leaking, things like that. Anything that happens with the x-ray machine, you must let us know right away so we can get it fixed immediately. Aluminum filtration. The purpose of the aluminum filter is to remove the low energy, long wavelength, and least penetrating x-rays from the x-ray beam. These x-rays are harmful to the patient and are not useful in producing a diagnostic quality radiograph. And I already mentioned this to you that most x-ray machines operate at a 70 kVp or higher and must have an aluminum filtration of 2.5 millimeters. This is a federal requirement, okay? And if you want to know where the aluminum filter is located again in the tube head, it's located where the photons exit the tube head. Yeah, the numbers do change with digital, and we'll get to that when we talk about digital, okay? Collimator is used to restrict the size and shape of the x-ray beam as a means of reducing patient exposure, and it may either have a round or rectangular opening. A rectangular collimator restricts the beam to an area slightly larger than a size 2 intraoral image and significantly reduces patient exposure. Okay, so it limits the dispersion again of the x-ray beam. PID appears as an extension of the x-ray tube head. It is used to direct the x-ray beam. So there's two different sizes, a short 8-inch, long 16-inch, and again, as I mentioned to you, they can come either round or rectangular. You have your patient protection, the lead apron and thyroid collar. Yesterday I showed you it in the lab. A lead apron and thyroid collar must be used on all patients for exposures. This rule applies to all patients regardless of the patient's age or sex or the number of images being exposed. The lead apron should cover the patient from the neck to the lap to protect the reproductive and blood-forming tissues from scatter radiations. And many states mandate the use of a lead apron. Okay, as I mentioned to you yesterday, it is to be hung and stored properly and not folded because creases may crack the lead inside of it. Now, newer models, they're more lightweight and flexible versions of the apron are replacing the older heavy versions. And care should be taken not to touch the apron with the same gloves that were used to place the film or sensor in the patient's mouth, which will cause cross-contamination, compromising infection control. So again, I also mentioned to you yesterday that if the patient drools all over the lead apron and thyroid collar, you must disinfect it, okay? So yeah, exactly. And the kids too. You got to watch everybody, you know. Now, I also mentioned to you about different speed. So we're going to talk about fast speed film. When using film-based exposure, the film speed refers to the amount of radiation required to obtain the image. The size of the silver bromide crystal is the main factor in determining the film speed. Remember that because I believe there is a question on your exam that asks you that. The larger the crystals, the faster the film. A fast film requires less exposure to produce a quality radiograph. Fast speed film is the single most effective method of reducing a patient's exposure to X-ray radiation. Fast speed film is available for both intraoral and extraoral radiography. We're going to be talking about both intra and extra. Intra is inside the mouth, extra is outside of the mouth, okay? And we'll get to those in a little bit in your other chapters. Now, image receptor holding devices. So yesterday we went over this also. It's the use of a film receptor holding instrument keeps the patient's hands and fingers from being exposed to X radiation. These devices also keep the film or receptor in a stable position and help the operator to properly position the film or sensor and the PID. So this is unnecessary exposure. I'm going to be real honest with you though. On occasion, you may need the patient to hold the x-ray, okay? Because not everybody can take the XCP rinse in their mouth.
Especially interiors.
Right, especially anteriors, especially people with torides. We'll be talking about all that later on as we get more into our lecture and our different chapters of when would we use the patient's fingers, okay? So we'll talk about that, but most of the time use the XCP rings, okay?
Those tricks.
Exactly. There's tricks and trades to everything, and we will show it to you. Now, exposure factor. Using the proper exposure factors also limits the amount of X-ray radiation to which the patient is exposed. Adjusting the KVP and the MAs and time setting controls the exposure factors. A setting of 70 to 90 KVP keeps patients' exposure to a minimum, and on some dental units, the KVP MA settings are preset by the manufacturer and cannot be adjusted. So ours can, but they're already pre-adjusted, so we leave them. All right, except when you're changing the different teeth. Yes, by book. The proper technique is necessary to ensure diagnostic quality images and to reduce the amount of radiation to which the patient is exposed. Images that are non-diagnostic must be retaken. So this is why you want to take the x-ray first time, right? Tell your patient stay still for, what, half a second, if that, because the thing is, if they move, if you don't place it right, you're going to need to retake it. And that whole story about them saying to you, oh, more x-rays, now they're going to look at you like another x-ray because you didn't take the first one right, okay? So this results in additional radiation exposure to the patients, and retakes are a major cause of unnecessary radiation exposure in patients and must be avoided. They're also unnecessary backtalk from the patient if you have to take them again.
They'll still fight you.
Exactly. X-rays during pregnancy. So the guidelines for prescribing dental radiographs issued by the American Dental Association in conjunction with the Food and Drug Administration, FDA, state that dental radiographic procedures do not need to be altered because of pregnancy. Again, they do not need to be altered because of pregnancy, because we should be basically using a lead apron, okay? So you use a lead apron during radiographic procedures. The amount of radiation received in the pelvic region is nearly zero. There is no detectable exposure to the embryo or fetus with the use of lead apron. I mean, sometimes we even do what's called doubling. We get 2 lead aprons, okay? So if one is nearly at zero, think about 2. It's absolutely zero. Exactly. And usually, yeah, the patients will know should not come and see us until the second trimester. We do see patients though, however, if they have an emergency, and we use all our protection, operator and assistant and patient, okay? So exactly. Operator protection and monitoring. So a dental assistant who fails to follow the rules of radiation protection may suffer the results of chronic radiation exposure. By following these rules, dental personnel can keep their radiation exposure to zero, and that's what we want, okay? So you want to make sure you're standing back, okay? So again, in our case, behind the x-ray barrier, the x-ray shield barrier, we want to make sure we're not standing in front of the primary beam. And we also want to make sure that nobody else is standing in the primary beam, and we go ahead and press the button while they're in the room, okay? In the office, you usually stand behind a wall. You stand behind the button. It's usually 6 feet away, okay? And we do the same here, okay? So we want to make sure that we do that to avoid exposure. Now, radiation monitoring. So there's 3 types of monitoring devices, okay, that are used to determine the amount of radiation exposure. We have what's called a film badge, a pocket dosimeter or dosimeter, some are pen style, and we have a thermoluminescent or TLD. So this is what a radiation monitoring device looks like, but I'm going to tell you right now, yeah, there are so many different kinds, and these are called badges. Excuse me. And we're going to talk about the rules of these badges, okay? So, yeah, never stand in the direct line of the primary beam. Always stand behind a lead barrier. One is available or the proper thickness of drywall. If a lead barrier is not available, stand at a right angle to the beam and never stand closer than 6 feet to the x-ray unit during an exposure unless you are behind a barrier. Dental assistants working in an unfamiliar office or treatment room should familiarize themselves with the proper position to stand in while taking radiographs. Okay. Now, do a lot of offices have badges? No, not really. Okay. Um, you know, yeah, I would say the same. Yeah, 1 in 10 offices. So if you go to an office and they don't have it, what do they expect you to do? They expect you to follow the rules, okay? Equipment monitoring. Dental x-ray machines must be monitored for radiation leakage. If a dental x-ray tube head has a faulty tube head seal, leakage results, and dental x-ray equipment can be monitored through the use of calibration device that can be obtained from the manufacturer or from the state health department. So in the new laboratory, the state of Florida already came out to check the equipment. And while they were here, they checked the other laboratory. They did it at the same time. Okay, if we didn't pass, then they would tell us that we didn't pass and they would give us a fine and we wouldn't be able to do x-rays. Thank God we did, so we are able to continue. Pediatric patients, if the patient is a child who's unable to cooperate, he or she is seated on the parent's lap in the dental chair, and then both the parent and the child are covered with the lead apron, and the parent holds the film or sensor in place. Does that happen often? Not really. Okay, and don't forget that on the control panel, there is the button for child, so make sure you change it from adult to child. Now we want to follow this concept, and this I'm going to tell you right now is on your exam. The ALARA concept states that all exposure to radiation must be kept to a minimum, or ALARA means as low as reasonably achievable. Remember that because it will ask you what ALARA means. Every possible method of reducing exposure to radiation should be used to minimize risk. The radiation protection measures detailed in this chapter should be used to minimize patient, operator, and staff exposure, keeping radiation exposure ALARA. ALARA as low as reasonably achievable. Now you're going to have patients who has questions off. They often have questions and concerns about radiation. And as the dental assistant, you must be prepared to answer such questions and educate the dental patient about the importance of radiographs. If you look on your email, I sent you a handout that is normally given to patients or how you should answer a patient when they ask you questions about x-rays and why are x-rays necessary. So please take a look at that handout because I will be asking you questions from that handout.
As far as the element.
Yes. And here's some examples of comments that you can make to patients during normal discussions. The doctor orders x-rays on the basis of your individual needs. I love that one because it's true. Because they're going to say, why do I need an FM? Why do I need x-rays? I just had x-rays a year ago. Okay. Here's another one. Our office takes every step possible to protect you from unnecessary radiation. Here's another one. We use a lead apron and thyroid collar to protect your body from stray radiation. We use a high-speed film or sensor that requires only minimum amounts of radiation. And here's an important one. Do you have any questions before we begin? Ladies and gentlemen, we should always ask that question to our patient because a lot of times when you stick an x-ray in their mouth, they want to ask you a question and ruin the whole thing. So you want to make sure that you ask them any questions, if they have any, before you get started. So that way you can also alleviate any of their fears. And then as you go along, they might stop you, of course, and ask you questions because they just remember something. So yeah. Exactly. And you need to have the answers, okay? You definitely need to have the answers. All right, guys. So let me just get out of here. And do we have any questions? Again, I don't know, for the students that are here, I cannot hear you for some reason. There's something going on.
It's on muted.
Let's see if I can unmute you guys. Because it says that you guys have your mics on mute. So it's not letting me hear you guys. Give me a second here.